Thank you, iGen, and thank you to everyone who's here making CareFest happen, all of the people in a little space backstage, all the people who are making sure that we get to where we need to be. It's a tremendous effort, and it's running so smoothly, and so I just want to shout out everyone who's making it happen behind the scenes. How are you guys doing? That's right, that's what I'm looking for. No, but how are you guys doing? Right. I know, it's late in the afternoon on day 2. I just called someone who I've known for years by a different name. So we're all sort of in this place, and so I just want to we're just gonna have a moment. You know, I do want to say that it's been a rough couple of weeks for humanity. And I'm not trying to ignore that, but I am saying that the vibes here are so good, and it's really doing my heart good, and it's wonderful to share this space with all of you. So I am ready to hear and to talk about caring for the caregiver with this incredible duo of women. Aisha Summers-Burke is the general manager and executive vice president of BET Studios, where she works with rising Black creators to make TV series and films. And Christy Turlington Burns, she is the founder and president of Every Mother Counts and the director and producer of the documentary No Woman, No Cry about the challenges women face throughout pregnancy and childbirth around the world. And as a Gen X person, I would be remiss if I didn't say that Christy is also was in the George Michael Freedom video, which is which is how I know her. I know her now as an advocate and as an incredible woman, but she also was huge in the development of my adolescent psyche. So with that said, you know, when they first approached me and said, we're gonna do a panel on caring for the caregiver, I was like, cool, that's me. That's me, I'm the caregiver, right? We can talk about how we can take care of me and how I can rest. And then I thought about it and I was like, that would be easy. But that's not what we're here for, you know? Like, we're here to celebrate, but we're also here to push forward. So today, I want to call us to our better selves, which we are our best selves. We're not always those people, but we can aspire to, right? We are all caregivers here, right? Professional, in the home, privately, to ourselves. But most of us are here in this audience because our caregivers are taking care of our people, our kids and our elderly, and those who are most vulnerable. So I want us to think about that. So when we think about caring for ourselves as caregivers, our caregivers are just like us. You know, 67% of them are women of color. Many of them are mothers also. So I don't want there to be a difference there. And so when we talk about taking care of us, we're gonna be talking about taking care of them as well. I also want to spend a little time on how we don't talk about this nearly enough. There is great pleasure, and it feels really good to care about people. You know, it feels good to take care of ourselves, but maybe there's nothing better than making someone else feel seen and cared for. And so I want to call that into this conversation as well. So finally, to my panelists, I want to say that, so we all got into the work we do, which is advocating for, this is, you know, one aspect of the work that we do, you know, advocating for maternal health, right? Telling stories that reflect real stories that tell the truth about our lives, people who are not always represented. And the advocacy work that we do, we all came to it because we've had very difficult care stories. For all of us, actually, I think it's fair to say, we had pregnancy and childbirth experiences and postpartum experiences that really showed us the cracks in the system. And so I want to think about how those kinds of things were encouraged to think of that as private, right? Like a very difficult birth or what happened afterwards. But as we all understand, our private lives are public issues. Yes, and so my question to each of you, I'd love to hear some of your stories here and understand what made you, in the wake of your experiences, decide to not just, you know, lick your wounds and nurture yourself and take care of yourself, but to turn that work outwards, to help others in your lives. And I'd also like to ask you, what has that service and care in the world given you? whether that's emotionally, spiritually. Yeah. Aisha, would you start us off?
Sure. So I think for me, it started when I gave birth to twins in 2019, and I had a flawless pregnancy and a flawless delivery, and then about 2.5 days later, I was in the hospital at the ICU. And I think for me at that moment, I felt like such a failure. And it was so kind of debilitating being in the hospital, kind of having this whole thing happen to me and not really feeling like I could talk about it.
Yeah.
And so I just kind of, obviously I'm okay. And when I went home and just kind of tried to forget about it. And then my husband, maybe a few years later, my twins are about to turn 4 in a week and a half, talked about it on a podcast and got pretty emotional. And I didn't realize how much the potential of me not being here with the twins was so impactful to him that I felt like me holding it in, not talking about it, and acting like it didn't exist wasn't probably healthy for him or me. And so I felt like this was the opportunity and time for me just to kind of open up about my experience. I'm clearly not the only one. We've talked about and heard about in other panels about, maternal Black women and death and, childbirth and all of that. So it just kind of felt like that was the time.
Yeah.
And once I did, it released all of this kind of shame and feelings of failure and why did my body do this or do that? And it just kind of set me free, honestly.
Yes.
And so that's when that happened. Yeah.
And what has it been like to, as you've been set free, what has it been like to engage with other people in that act of storytelling and witnessing their stories?
It's been really good. I mean, a lot of my friends are having children, and so once my husband and I kind of opened up about our experience, a lot of my friends have come to me to say, what happened? What can I do? Who was your doctor? Asking about the experience, what are the things I should look out for, all of that. So it kind of gave a small community of people feeling like, oh, okay, well, this happened to her, so I can ask her about it. She's open about it, because sometimes you don't know if people are truly open about their experience. And so that's been nice. It's been nice to kind of feel like my experience has been helpful to others. It's also been a cautionary tale. And it's just been really good for me and my husband.
I love that.
Yeah.
Christy?
Yeah, so I similarly, through my birth experience, just came into a whole new journey for myself and my life path. I became a mom in 2003, and after a really healthy pregnancy, lots of options for where and whom to give birth with, I had an unexpected postpartum complication, one that is the leading cause of maternal death worldwide, actually. It completely floored me because I wasn't expecting it, but I also had the good fortune to be in a birthing center within a hospital in the care of an incredible team, a team of a midwife, a doula, a few nurses, and a backing OB-GYN who came in, managed the complication. They worked together seamlessly. It was a painful experience, but I felt very much cared for. I felt like my experience was centered in this experience. And I was really grateful to have that. I came home, a bit beat up and recovering, but still feeling so empowered in the act of becoming a mother. But my first question to myself and to my friends and people I was sharing my experience to was, what about everybody else that doesn't have access to this care, doesn't have that team-based support, doesn't have a partner there or an advocate by their side? What about all of those girls and women and birthing people around the world? And so I didn't know exactly what I was going to do, but I started talking and sharing my story immediately. And I learned by doing so that so many of my friends had similar stories, similar complications, worse complications. And I thought, why aren't we talking with each other? And helping prepare one another and making those recommendations to providers that we felt safe with and saying, have you tried this? Have you thought about a doula? Have you thought about a midwife? And so that was the very beginning of it. And then it just kind of kept growing and blooming. I went back to school to study public health 2 years later. While pregnant with my son, I traveled with a humanitarian organization called CARE to Central America, where my mother is from. And that's where I had an aha moment of, if I gave birth in this community and had the same complication, I would not have survived. And I left that experience and that trip thinking, I'm going to do more. I made that film, No Moment, No Cry, and I started advocating. I wanted to become the best possible expert that I could become to be able to talk about maternal health. Maternal mortality was just starting to be talked about on the global stage, on the development stage, around the Millennium Development Goals. And the US maternal health crisis was not being talked about at all. There were hundreds of thousands of girls and women dying every year globally, and those numbers had not changed in decades. And suddenly in 2010, when my film came out, and I started Every Mother Counts as a campaign initially, just to raise awareness and start talking about the experience, we were ranked 41st in the world. Today, the United States is ranked 55th in the world. We have continued to fall behind, as was said on the previous panel. We've doubled the number of maternal deaths in this country in the last 25 years. We are one of 2, I think, countries in the industrialized world with a rising maternal mortality rate, and we pay more per capita on healthcare than any nation in the world. Unacceptable, just unacceptable. And once you know that, you can't not know that.
Yeah.
So it's like, it was more. And so I've been, Every Mother Counts is basically an organization that advocates for equitable access to safe and respectful care for every mother everywhere, every person everywhere, honestly. And this is work that we've been doing for 14 years. There's more need than ever. There's an incredible awareness now and visibility, which is wonderful. But we need more of us, more voices. Aisha's voice, Elaine's voice. I'm so excited when there's new advocates that I meet or newer advocates that I meet. I was like, thank God, because it's exhausting.
Yeah, and so I want to transition in a little bit of time that we have left here. So we're telling our stories, which are formative, right, of how we came into motherhood and the things that we realized. But kids grow up. Christy's youngest is applying to college now. And so my children are 9 and 5, and I'm older, and we all have aging parents right now. So I want to talk about the sandwich generation and how that is something that's affecting us. And so I would like for you guys just to tell us, what are your care needs now? Who do you need to help take care of you and your people? And what would you like to see within this system that could guarantee that your people could be taken care of, as well as the people who will provide this essential care for you?
So for me, so obviously I take care of my children, but I also have older parents who have recently moved down to LA. I have a father who is in the early stages of memory loss, and so him and my mom moved down so that I could be around to make sure to help in any kind of way that I needed. We have a great support system. My mom is great. We have a shared nanny for the twins, and then my husband and I kind of do the rest. I do have a brother who lives, close by who helps, but I think that in general, for me, it would be nice if there were, taking care of me. I think I have to figure out how to get the space to kind of figure out how to take care of me. It's actually one of my goals. It was one of my goals for this year. It will continue to be my goal next year.
It's a goal that will carry over always.
It's
a daily
hard,
goal, yes.
It's hard to really kind of do that and take care of yourself, and then making sure that the others are taken care of. For me, the biggest thing is resources. How do we get to a place where resources are for everybody? I feel like I sit in a very privileged seat, and it's still hard for me to get resources. The same thing in terms of, if I'm having a struggle, then where are the people who, don't have the resources, or don't have the time, or can't take off work, or don't have extended family, or all the things, and they're just really, really hard to get. So that would be my thing of how do we get everybody the same resources no matter what situation you're in. That is a big, big thing for me. So, on a small level, what I do is I'm very type A. So, I have a spreadsheet of resources. My son also has a speech delay and he's an OT. And so, I have all the speech therapists that I think are great, and I'd get them from my friends and his classes and their parents and the OT people. And so I do kind of a running list I'm sharing with my own community, but that would be nice on a larger level where everybody has access to it.
Again, a private thing that you're doing that should be a public resource for all of us. Yes.
Yeah, and I'm in a similar situation, although probably the next phase. Really, my mom's a little bit more advanced in dementia, and she lives on her own. My father passed away a long time ago, and she lives across the country from me. I live in New York, and she's here in California. I have two sisters, and so we've been trying to kind of, contribute as we can and share the responsibilities of, monitoring and sort of being prepared for the next phase of where she's at. And I'm probably the best suited at this point as I'm empty nesting or beginning the empty nesting phase to be able to come back and really wrap my arms around my mom again. And that feels like a beautiful thing, and I feel very lucky to be able to do that and plan for that. And it really requires, as I've been talking to so many parents of younger kids like yourselves, remembering like the hardest things for me with little kids is like being so tired and having the patience. And I think that's what my mom is really needing right now. She's requiring like safety and love, but also patience and continuity. And so continuity of care is so important in these various different phases of our health needs and care needs across the spectrum of our lives. But I feel like right now, it's continuity of care for her and really being there to just be present and to be able to give her as much as I possibly can and make the space for it. But I feel lucky that I'm able to do that right now.
Yeah, and I think we're all aware, with aging parents that we will be relying on other people. We're not meant to do it alone, and we can't. And I think we'll stretch ourselves to the point that we can, but then we're going to rely on professional people who bring an incredible set of skills. And so I want to end on this note that we don't have answers here, but I wanted to reflect. Like our care needs change over time, and they just when you think you're done in one stage, you're moving on to another one. So we need to think about making that time for ourselves and then also caring for the others who are doing that work. And, we are all vulnerable, we're all interdependent, and that's precisely what makes us human. And that sort of human solidarity that we have with each other is really, another word for it is love. And when I think about what is good for each of us in our care stories and what we need is what is going to be best for all of us. So thank you, Christy, and thank you, Aisha, for sharing the stage with me, and thanks to all of you.
Thank you.